50, about half of all people will have at least one lump on their thyroid, although most people will have no idea it's even there. Should you be worried that it could be cancer if you do find one? Well, Diane Atwood, who writes the blog Catching Health, is here to sort of brief us on what all this is about.
Yes, first a little reminder, the thyroid is this butterfly-shaped organ it's a gland actually, that's right in the middle of the neck. It makes two hormones that regulate how the body uses and stores energy, so it's pretty important. And as you mentioned, lumps can be found in the thyroid gland. They are also called nodules. Now, fortunately, up to about 95% of them are totally benign. No cancer, no problem. But usually they don't cause any kinds of symptoms, and they're so small that people don't even realize they may have one. So I've got a little list of symptoms that you might want to pay attention to, that you're able to feel the lumps. If you notice swelling in your neck, if you feel as if there's something in your throat, if you have trouble swallowing or trouble breathing. Obviously, if you have any of those symptoms, you should see your doctor. But what about routine screening? So there's a test called an ultrasound. I'm sure you've had them. Probably all of us have had one at some time of some part of our body. But an ultrasound of the thyroid is probably the best way to pick up and evaluate a nodule in the thyroid. The only thing is, it's not recommended for routine screening. So I asked Dr. Daniel Oppenheim, he's an endocrinologist at May Medical Center. I asked him why that was, and I have a quote from him. He says the difficulty is that thyroid nodules are very common, overwhelmingly benign. If you were to do an ultrasound on everybody, you would no doubt find lots of nodules that have no clinical significance or meaning whatsoever. So what should we do? So Dr. Oppenheim says that your healthcare provider should always do a thorough exam, and a hands-on exam of your thyroid and your neck every time you have your annual physical. And then if a lump is found, or if you have symptoms or risk factors for thyroid cancer, then you should get an ultrasound or possibly other tests.
So it's more of a follow-up test than a screening test.
Right, you don't start off with a screening test. So you'll find a list of risk factors and information about treating thyroid nodules on the Catching Health blog. And if you have anything that you would like to add to the discussion, there's a comment section at the end of the blog post. And I always love to hear from people.
I'm sure you learn a lot from your readers as you have this sort of back and forth with them.
I do. Yeah. People tell me their stories, and no one's ever shy about telling me what I haven't said.
I'm sure they're not. Thanks, Diane, very much. We'll see you again soon. Okay. We'll be right back to wrap things up.